Now the following video will give you some instructions on your exercises for the first 2 weeks following your anterior cruciate ligament reconstruction. Now all of you will be non-weight bearing, so when you're on crutches, not putting your foot on the ground, and you'll be managed in long splint to keep your knees stable and safe. 3 or 4 times a day, I suggest you get out of the splint, and we're going to go through a series of 3 very simple exercises just to get your knee moving and to get some of the muscles starting to contract again. Again, the exercises aren't designed to be painful, they're very gentle, and they're just more of a keep your knee going type exercise rather than really building strength in that first 2 weeks. The first exercise is very simple. You can do it with your knee in your extension splint, and I suggest you do this one a lot. I'll get up so you can see. And it's your foot moving up and down, so pointing and coming back towards you. This is a good circulation exercise. It shouldn't be painful at all, and we should be able to do it 10 times, big movements up and down every hour on the hour. Little bits and often with this one is the key, just to keep some circulation going in your leg. The other 2 exercises are really only the 3 or 4 times a day, and you start off doing little bits and often. So you might do the first few days only 5 or 10 little exercises rather than a whole set of 20 or 30, which you build up to after around a week. So the first one is a little heel slide. So you're laying on your back, your splint's undone, and you're just very gently sliding your heel up and down the bed. If you need to, you can sit up a little bit, have your hands underneath your thigh and just help your leg come up and down, but it's got to be nice and gentle, not through pain. Definitely don't want to get up to around 90 degrees, that can be uncomfortable, and if you've had a meniscus repair, damage the meniscus. Most people will be happy just doing that 30-40 degrees, bending up and down. Again, start with 5, maybe 10 repetitions, and you're going to build up to doing probably 30 by the end of the first week or second week. The second exercise, we use a rolled up towel. Any towel, a beach towel or a bathroom towel will be fine. You pop the towel underneath your thigh, laying down relaxing, and then gently going to contract both your hamstrings and your quadriceps at the same time. So if you dig your heel gently into the bed, tensing up your thigh muscles at the same time, you're getting good contraction on the top and bottom, and you're squeezing those muscles for a period of around 5 seconds, and then relax. And again, you repeat this 5 to 10 times, holding for 5 seconds, and then relax, and trying to run through that and build up the number of repetitions as time goes on. As you get a little bit further into the second week, you can do it on 2 rolled up towels, so your knees up in a little more flexion. But again, it's an exercise which is gentle and is there to just get some muscle contraction so that you don't lose too much muscle bulk in that first few weeks. Now, these 3 exercises are really the only ones you need to concentrate on for the first 2 weeks following your surgery, and then that's the point when you'll see your physiotherapist for some more formal exercises at that point. Hopefully this is helpful for you, and definitely if you have any questions or worries, contact your physiotherapist or your doctor to get some more information. Thank you.